Hello there. My name is Dr. Mary Kay Keller, and I sit on the board of Infant Massage USA as the board president. I also presented this year at a conference that we had in June on the topic of experiences of young fathers under 25, challenges, supports, and opportunities for CM intervention, and gave kind of a global perspective of that. I'm both a CM and a CFLE. A CM is a certified educator of infant massage, have been since the late 90s. And I am a certified family life educator through NCFR, the National Council on Family Relationships, and have been a member of them as well since about 2002. So the presentation that I did was the experience of young fathers under 25, challenges, supports, and opportunities for intervention. You can see this particular article. So I chose one that was very recent from 2025 from the American Journal of Men's Health. And it's about engaging young dads in the discussion of family health and results from the primary study. So as you can see from the abstract, inclusion of fathers in research initiatives related to maternal and infant health outcomes is limited, though fathers' involvement with their families has been associated with positive family health outcomes. Engagement of fathers must be done with an understanding of how men view health and fatherhood. This particular study explored both qualitative and quantitatively whether men's perceptions of their health and what their healthcare seeking behaviors were. So they're trying to find out how fathers relate to this. This observational study utilized mixed method approach. As I said, it collected data from fathers who were expecting or had a child under 12 months old, and they did this through a mixed study, which means that it had both qualitative and quantitative data. They were invited, in the way they accomplished this was through an electronic survey, and eligible fathers were invited to participate in focus groups, discussions, and these questions covered 4 topic areas and were analyzed and themed by these outcomes. Of the 73 eligible fathers who completed the electronic survey, 13 participated in the focus groups. So the focus groups are a representation of 13 different fathers, where the electronic survey would be more of an outcome of 73 fathers who participated. Physical health and mental health were mentioned more often, along with prioritizing healthy routines and habits and self-improvement, and these were predominant. Fathers also highlighted being positive role models and being committed to their partners. When discussing, which, that's very important because we don't realize that, like I said, 90% of human communication is nonverbal. We model what we see. So when these babies are born, they are modeling their fathers. And one little tip I'd like to give you is at about 19 weeks, the baby's hearing has developed, and they can now hear people outside of the womb. They can hear their mother's voice, they can hear their siblings' voices, and they can hear their father's voices at that time. So I suggest to fathers in my private practice, when I'm teaching them infant massage, that they read to their babies right around 19 weeks, because when that baby comes out, that baby will definitely turn its head towards the father. One of my favorite things to watch was Barry T. Brazelton. He would hold the baby up between himself and the father and have him call the baby's name, and invariably said any baby worth its salt turned its head towards the father. So as we see, becoming a new father can be a pivotal time for men. Going through pregnancy and childbirth with their partner has been shown to have a notable impact on their physiological as well as their physical health. Fathers can even have long-term benefit effects on men's health, and the stability of the father's relationship with his partner can impact the health outcomes of both the father and mother. So a total of 87 fathers indicated in the recruitment survey that they were interested in participating in the study, and after completing the recruitment, 73 fathers were identified as being able to participate in the focus group. So I'm going to get down to the discussion and the implications. Fathers' philosophy on health. Let's just go there. Perception of healthy living evolved from historical gender roles that developed healthy is not always evolved as socially masculine. So they're also buffering up against the sexism that we have. So I'm going to stop sharing my screen right now and just kind of come to a conclusion here. What this means for SIEMs and SIMIs is that we need to be more engaging with the fathers. We need to give them permission to be in there because they've been conditioned to think that that's not what should be happening. So anyway, I really appreciate you sticking with me through this little presentation, and I hope you, if you have any questions, feel free to reach out to me at Mary Kay Keller at infantmassageusa.org. Thank you so much for having stayed with me this long.